An example that comes to mind is a patient, 66 years of age, a father of a physiotherapist, that felt a tear in the back of his knee, and after not improving with conservative methods was referred to me. And I will show you this example on this slideshow. So this gentleman is 66, is an active man, and while stepping on a high fence, he felt a tear in the back of his knee. Although his symptoms have improved with the care of a physiotherapist, it's still not right, and he was referred to me for a further specialist surgical opinion. When examining him, he had a normal BMI with a normal limb alignment. He had slight amount of stiffness. The knee was not very irritable, and he was not particularly tender when palpating the posterior horn of the medial meniscus. He was, however, tender when palpating the tibial condyle underneath the joint line. I will show you here his x-rays, and it is very subtle, but it is obvious the joint space difference between his left knee and the right knee. In the medial side, the joint space is slightly reduced compared to on the left knee compared to one of the right. When we look at his MRI, one can see the meniscus, that is the block structure, the shock absorber, the bushing, and the cartilage that is well preserved on the lateral compartment. The meniscus on the medial compartment is extruded, is pushed out of the joint, and the patient has a large amount of bone bruising in the medial tibial condyle, illustrated there. The other thing that one will note is that the white, bright fluid is filling the lack of cartilage, whereas on the lateral compartment he has cartilage, and this is the tear of the posterior horn of the medial meniscus. So in this patient, where the meniscal tear, it's traumatic, but it's in the presence of a lack of cartilage, surgery could constitute a further injury to the knee. And this is a good example where conservative treatment should be first choice. I treated this patient with managing the load through his knee, reducing the amount of walking that he's doing, and actually encourage him to get on the exercise bike and do non-loading type exercises such as cross-trainer, exercise bike, swimming, and rowing, where when we perform those exercises, we don't transfer loads through the knee. This patient took 6 to 8 weeks, and eventually, with non-steroidal anti-inflammatories, managing the swelling and managing the load that went through his knee, he improved.